Hi, my name is Dr. Jess Waldura and I'm the medical director here at Santa Rita Jail. I wanted to talk to you today a little bit about the COVID-19 outbreak in Alameda County and how it's affecting life here at the jail. The first thing I want you to know is that COVID-19 is spreading around the country and in the Bay Area, and that this is causing everybody to experience a lot of fear and anxiety. And I know that for the inmate population here in particular, especially if you feel disconnected from your family and loved ones, you might be feeling nervous and afraid. So I wanted to address some of the commonly asked questions and perhaps allay some of your fears. The first thing is that although COVID is spreading within the Bay Area, there really are very few cases here so far. There's about 1.6 million people living in Alameda County, and there's only 164 known COVID cases so far. And that means that even though it's out there, very few people have it as of right now. We are working very hard here at the jail to stop the spread of COVID into the jail. Most people who have COVID-19 have a very mild illness. Some people have no symptoms at all. And those people who are infected with it tend to recover quickly without any problems. There are some people who have a more severe illness, and those people perhaps might need hospitalization, and we are absolutely prepared at this point to send anybody to the hospital who needs to go to the hospital. So what can you do to help? The most important thing that you can do is the same thing that everybody else in the community is doing right now. I want you to remember to wash your hands frequently. You've been provided with soap in the bathrooms, and you should be washing your hands throughout the day. Try not to touch your face, and if you do touch your face, you should wash your hands again. One of the most important things you can do is try and maintain a 6-foot distance between you and other people. COVID is mostly spread through droplets from the nose and mouth, sneezing, coughing, and those droplets tend to fall to the ground quite quickly, which means that it's very hard to infect someone at 6 feet, even if that person does have COVID. So maintaining distance is really helpful. When it comes to sleeping in dorm areas, if you sleep head to toe with people who are close to you, that can help too. The other thing is you're going to be provided with cleaning supplies, and I want everybody in this community, in the housing units, the inmates, the deputies in their offices, all of the medical staff and all of our administrative areas to be wiping down and washing surfaces frequently throughout the day, because that's going to be able to kill virus that's out on surfaces and help prevent the spread. If you do feel sick, especially if you have any kinds of cold or flu symptoms, you need to alert a medical person right away. We are taking those types of reports of cold and flu symptoms very seriously, and you will be evaluated within a short period of time. I know there's some questions out there about quarantining housing units, how we decide to quarantine housing units and what it means. We've decided to quarantine certain housing units because we are concerned that there may have been an exposure in that community, and we're waiting to see if anybody gets sick in that community before we allow them to interact with other people inside the jail. It doesn't actually mean that anybody did have COVID in your community. It just means that we're concerned somebody might have, and in order to protect you and keep you safe, we're going to lock down that housing unit for up to 14 days and monitor you. As of right now, there have been no cases of confirmed COVID infections in the jail, and that's true in all of both inmate populations, the deputy populations, and in the medical staff. So we will be quarantining some housing units in order to keep a better eye on those people, but it doesn't mean that you're all going to get sick, and it doesn't mean that we know for sure that there was COVID in your area. I want to also talk about testing a little bit. I know that many people want very badly to get tested because it feels like it will reassure you that you don't have the disease, and then you can stop worrying. But Unfortunately, the current recommendations from public health are only to test people who have active symptoms. And part of the reason is this: if you do not have symptoms and you have a negative test, it still doesn't mean that you couldn't fall ill over the next day or two. So it isn't really going to reassure you. The fact that you have no symptoms is actually more reassuring to us than what the test says. However, if you do have symptoms, we will test you, and many of those, we've done a number of those tests on people inside the jail so far. All of them have come back negative. So just because we're testing someone doesn't mean it's going to come back positive, and it may or may not change even how we manage the situation. Anybody who has symptoms of a cold or flu will be removed from their area by themselves while we figure out what's going on. But it doesn't necessarily mean that they have COVID. They may have the common cold. It's much more likely, in fact, that they do. And by the way, there is still flu out there, and flu spreading throughout the community, out in the outside world and in the jail. So some of these people who look like they may have COVID may actually just have the flu. And the last major thing I want to talk about is use of masks. I know that there's been a lot of concern that the staff are wearing masks more often, and maybe that the inmates don't have masks, and you might feel that you would want them. I think that it's definitely understandable that you might want masks. What's more important than a mask is that staying 6 feet apart from each other, the hand washing, not touching your nose and mouth. Those things are even more important than wearing masks. But the reason that we are wearing masks as staff now is to try and prevent us from bringing COVID into the jail and infecting you, because you're in a safe environment right now. You are in a locked down environment. That means you're protected actually from the outside world. We're the ones who are bringing stuff in from the outside world, and we're putting you at risk. So we're wearing masks not because we're necessarily sick. Very few of us have any symptoms of any kind. We're wearing masks in order to try and make sure that we don't bring COVID to you. You don't need to worry so much about transmitting it to each other, because if you don't have any symptoms, really there's pretty much no risk of that. So I just want you to know that your health and safety is our absolute top priority. We are working on this 24 hours a day, 7 days a week, and we have been since weeks before it even got here. And we continue to work on it every single day. We're working with the Alameda County Public Health Department, the Office of Emergency Services, the state health departments, and the CDC to make sure that we're following all of their protocols to the letter to protect your health. And I hope that this is reassure you a little bit that we are thinking about you, and that we want to make sure that your health continues to be our top priority. I think you actually probably are safer than the rest of the community out there, and we're going to continue to monitor the situation carefully.